Hello, I'm William Lau. I'm a third-year UCSD student, and I'm in the Community Health Associates program for the 2016-2017 academic year. So I am working with VA San Diego, located in La Jolla. And over there, I am a veteran experience intern, where I help become a voice for the veterans, for the clients that come in to the dermatology clinic specifically, and just voice their concerns, and even just voice their praises for the system, so that just the Veterans Administration, the Veteran Affairs, understands what their clients see, what they expect, what they appreciate, and what they want to be improved upon. And I do this through administering electronic surveys that the VA has implemented this year. It's a new thing they're doing. So I help manage all these surveys, and these help locate key problems that are overlooked or just not seen at all. Key problems that are recognized by the administration itself, and just to recognize any great services, or even just great individuals who are in the system that clients or other veterans, they recognize and they appreciate. So many of the organizational challenges I've seen at VA are just related more with I guess the administrative side of things. Concerning care and services, from what I've seen and from what I've heard from from the patients, the VA offers phenomenal care. I've heard stories. I've heard of the stories, some where some people from like Oceanside are willing to drive all the way to the VA healthcare center just because they love the care so much. They love the people, and they really appreciate the services they offer. And they also talk about how, despite being a free service, it's very high quality for being free. Something you don't really expect too often, especially in our society. So going back to the challenges, it's more administrative and I guess logistical. There are a lot of problems with wait time, especially, and this is probably like the result of so many people coming just because they enjoy the service, they like the service there. But many people coming in piles up, and it really compacts the system, you could say. And there's not really much that's been implemented to manage this influx, other than just people have to wait longer. The VA doesn't sacrifice patient time, like doctor-patient interaction time, to accommodate for the influx of patients, which pushes the time back, which is a good thing. I mean, every patient should definitely have meet with the doctor. They just meet with the doctor with sufficient amount of time, and especially just go over everything. But I feel that there needs to be a bit more providers, at least from my observations. There need to be more providers to accommodate the influx, and even more space, because there isn't that many rooms to check in patients more. So that's why the flow is pretty backed up. And I've also seen where it's so backed up when patients have to reschedule. It's like 5-6 months back for the next follow-up, like on average. So that's a problem. So I feel more providers, if possible, even maybe an expansion in space to accommodate for the influx of patients that come in. And I'm learning a lot from this experience. I'm definitely seeing how the VA system works and how it compares and contrasts to, say, like the private systems. Overall care is amazing. I've seen all nurses, all doctors, just all the staffing too. They're really amazing people, and they really enjoy what they're doing. It's amazing to see how every single one of them are affiliated with the military. So that probably might be a requisite for the job at the VA. But it's great to see, since it's easy for just all the staff to connect with the patients, with the veterans, and it's pretty cool to see how they talk to each other, by how they like recognize each other by rank and everything. And me, I don't have any affiliation with the military, so it's a new experience for me. I'm learning a lot from it, and I mean, I've learned that VA is an amazing system. It has its problems, but this is just, so far, just in La Jolla I've seen. This may or may not apply to other VAs around the country, although I would assume it would. But yeah, quality is great. Wait times are a problem just because of the influx, and that needs to be addressed.